It's the dream setup.
Getting all of that data, the person's personal data, and then setting up a treatment plan. It's not, hey, come in, you want to get on a weight loss program, which, there's
What's your guys' approach with the wellness center? Is that someone coming in, they're seeing a physician, they're getting that comprehensive blood work assessment, and then you guys are giving them a protocol? Can you describe what that looks like a little bit?
Yeah, so the wellness centers, it is a comprehensive approach. So first step is they come in. Everyone usually has either a goal or a problem that they're trying to solve. So what we're doing first is we're trying to get to know our patients. So we're doing a lifestyle assessment and questionnaire. We want to know exactly what they do on a day-to-day basis. Do they exercise? Do they eat? Are they smoking? Are they eating? Like, what are they exposed to? Are you a cop? Are you a firefighter? Are you being exposed to chemicals, carcinogens? Are you at the shooting range and getting exposed to lead? And that's probably why you got that brain fog that's going on. So for us, it's like really taking that deep dive and understand the person first. So once we do that lifestyle assessment and questionnaire, that's where we're going to the next step, where now we're going and we're diving on the, looking under the hood. We're diving in that area. So what does that consist of? All right, we're going to do a body composition analysis. So we start off with the InBody assessment, and we're also doing the DEXA scan same day. Reason why we do them both the same day, they're giving us pretty much the same data. DEXA scan is a lot more accurate. Is that the DEXA scan, we can only do it due to the Board of Health only once every 3 months. So we use the InBody to trend their program on a weekly basis, when they come and do their weigh-ins. So some people ask us, like, well, why don't you just have them get on a scale at home? Well, scale tells me total weight. It's not giving me true body composition analysis where we're looking at intracellular, extracellular, lean mass, visceral fat, which that's one of my favorite ones. Looking at adipose fat. So we're looking at the body composition analysis. Then we're going to go ahead and do the VO2 max, which VO2 max, a lot of different benefits. We're looking at endurance, cardiovascular, and also we could calculate fat burning zones for the patient. It's also a great tool to look and see for mitochondrial function. And then we have our RMR, which is the resting metabolic rate, where we can see exactly how many calories they're burning at a rested state. And then customize part of their program like nutrition and macros and micros that they're going to take. And then we're doing the blood work, which in the blood work goes through what I mentioned earlier, but we do epigenetic testing.
Wow.
We're doing, all the other things, your typical kidney function,
Yeah.
liver function, hormones, and hormones, we're diving deep into that as well too. So from there, getting all of that data, the person's personal data, and then setting up a treatment plan. It's not, hey, come in, you want to get on a weight loss program, which, there's things that have become very popular, like the Ozempic and stuff, which do work, right? But what we want to do is let's actually figure out what's going on with the person before we just start jumping to any of these programs or any of these medications.
It's the dream setup. It's what I try to mimic. So I have a traditional primary care practice that's insurance based. I can't do all that stuff. Like, just realistically, and I think it's fun for people that are listening to think about that, right? A lot of listeners are my patients, right? A lot of people can't afford this stuff. It is pricey.